So we want to thank everyone that's joining us and all of those that will get on here in just a second. We have a real treat for us. My name is Jessica Castaneda. I work with the IDRC Consortium. And today we have some special guests from the Farmworker Health Network. One of the things that happens in Migrant Ed is sometimes we're very siloed. We're very focused on the needs of our kids and working with the school districts and trying to find them in the community. And I feel like one of our weaknesses is really looking at the partners that are doing similar things and can really offer services and have resources that we can be aware of. And so we have a poll out there right now asking you guys how many of you know of the Farmworker Health Network, and 79% of you said no. So hopefully this will be very informative. We want you to kind of listen as they're sharing. They're going to be sharing specific resources and ideas and what they do. And so we can particularly listen for, how to find a clinic that we can work with, the resources that are available for the workers. So I'm going to turn the time over to them and want to say a big thank you to Alexis for help organizing this and for all of our panelists for giving their time today and sharing their resources. So I'm going to turn my stuff off and turn it over to Alexis.
Thank you, Jessica, and thank you everyone for joining us. We're really excited to be here and to just share with you a little bit more about the organizations that are part of the Farmworker Health Network and to really strengthen our partnership with migrant education. So there are 6 organizations who are part of the Farmworker Health Network: Farmworker Justice, the National Center for Farmworker Health, MHP Salud, Health Outreach Partners, Migrant Clinicians Network, and the National Association of Community Health Centers. So today we have representatives of these various organizations. I'll introduce myself first. So my name is Alexis Guild. I am the Director of Health Policy and Programs at Farmworker Justice, and I'm also currently the chair of the Farmworker Health Network. And then Monica, do you want to introduce yourself?
Sure, thank you. Hi, everyone. Thank you so much for having me here. My name is Monica Garcia, and I'm with MHP Salud, and I'm the health strategy specialist with the organization. So happy to be here.
Liam?
Hi, everyone. My name is Liam Spurgeon. I'm a program director at Health Outreach Partners. So yeah, thanks for the invite.
Jillian, we'll just go in order.
I'm the blank square that Alexis was trying to replace. My name is Jillian Hopewell, and I am with the Migrant Clinicians Network, and I'm really happy to be with you all.
Margaret?
Oh, okay. Hi, good afternoon and good morning to some of you. My name is Margaret Davis. I'm the Director of Knowledge Management and Learning here at the National Association of Community Health Centers. Happy to be with you.
Gladys.
Hi, everyone. Good afternoon. My name is Gladys Carrillo. I am the Director of Program Services at the National Center for Farmworker Health.
So we'll talk more in a little bit about our organizations and why we're called the Farmworker Health Network and the work we do both collectively as well as individually to support health centers and farm workers. But first, we are going to just talk a little bit about the health center program, provide a little bit of background, and then we'll introduce you to the Farmworker Health Network, who we are, what we do, and the resources we can provide to you to share with your farm worker communities. And we'll identify ways that you can connect the farm worker families that you work with to healthcare and to information to support their health and well-being. So with that, I am going to turn it over to Margaret from NAC, who will talk about the health center program. And we certainly encourage you to, please at any time include any questions in the chat, and we'll have time at the end also for discussion. So Margaret, please go ahead.
Great. Thanks, Alexis. So you can say a lot about issues with America's healthcare system. It can be a pretty polarizing issue. But if there's one thing that all political parties have agreed on for more than 50 years, it's that health centers play an indispensable role in providing access to the most vulnerable and underserved communities across the country. Health centers were born out of the civil rights movement and the war on poverty. They were initiated as a demonstration project to not only improve health, but empower communities. Prior to the first two health centers that were started in Mississippi and Boston, the Migrant Health Program was authorized and funded to provide critical health services to migrant and seasonal agricultural workers. This was then incorporated into the overall health center program model. Next slide. The health center model is designed to bring together healthcare to the community that otherwise lacked access to services. The cornerstone of this model is that the patient and community are directing the care, the community that determines that what needs there are and how to bring those forward. Next slide. And often these needs go beyond traditional patient primary care needs and address what we now call the social drivers of health: food insecurity, housing, working conditions, environmental health, etc. Next slide. So health centers are independent nonprofit organizations or aligned with public entities. They not only provide needed services, but they have certain critical requirements as part of their funding requirements. They're required to provide comprehensive, culturally competent, high quality care, and often integrating that care with pharmacy, oral health, mental health, substance abuse. They're also required to provide care at a sliding fee scale and see patients regardless of health insurance status or ability to pay. They're required to provide case management, transportation, translation, and other needed enabling services. And as I mentioned, they're community-based and patient-directed. What this means is that 51% of the health center's governing board must be patients of the health center. Next slide. From the modest beginnings, health centers now serve over 30 million people in the United States, including 1 million agricultural workers, 1 in 5 rural residents, and 1 in 3 people living in poverty. This is due to continued bipartisan support and funding for the health center program that the health center program has continued to receive. This funding has seen a steady increase since the beginning of the 2000s and continues today, with sharp increases of support to combat the COVID-19 pandemic. Next slide. Oh, actually, Alexis, go one back. I forgot to mention the key stat up here at the top, 14,000 delivery sites. That changes daily. A new site will open, another site may close, but it is always net increase. So we're going to talk about in just a second how to find a health center, but I can guarantee you that there is one in your vicinity. So the next slide. So health centers, as I mentioned, provide a wide range of services, including oral health, behavioral health, and substance abuse disorder services, primary care, and prenatal services. They also play and continue to play a critical role in dissemination of vaccines over the last 3 years of the COVID-19 pandemic. And we're really pivotal for the administration in ensuring the distribution of vaccines to racial and ethnic minority communities. Next slide. The Health Resources and Services Administration, which is part of the Health and Human Services Department in the federal government, funds community health centers, migrant health centers, et cetera. They have a website called Find a Health Center. You can Google it, or you can follow it on, if you can read at the top of that bar. And you can put in your zip code and you can scroll down and find a health center close within your vicinity. You can get the contact information and reach out to that health center. It is not, many health centers do have a waiting list. It is sometimes challenging to get your first appointment, but they are open to everyone regardless of ability to pay. They are out there for your clients, for your families and children, and we hope that you reach out and connect with them. Next slide. All right, now we're going to hear from all of the partners here in the Farmworker Health Network.
Thanks, Margaret. So before we introduce ourselves and our organizations, just quickly about the Farmworker Health Network. So Margaret shared that health centers receive funding from the Health Resources and Services Administration. They also fund national organizations to provide training and technical assistance to these health centers. There are 21 national organizations. They are called National Training and Technical Assistance Partners, who provide training and technical assistance to health centers on a variety of topics. And of those 21, the 6 of us are the Farmworker Health Network, and we especially NCFH, Farmworker Justice, Migrant Clinicians Network, MHP Salud, and Health Outreach Partners specifically provide training and technical assistance to health centers that serve agricultural workers and their families. So because we all receive funding to provide training and technical assistance, we work together to make sure that the training and technical assistance we provide is not only helpful to the health centers and the communities, but also to ensure that we don't duplicate each other's efforts. And as you'll see, each organization has its own unique expertise, and we are able to work together collectively to provide joint training and technical assistance. We also meet regularly to share information and to discuss any issues that we hear from health centers or farm worker communities, to share with the staff at the Health Resources and Services Administration. But then we also, of course, have our own resources and technical assistance that we provide that align with our unique expertise in organizations. So with that, let's get to know the Farmworker Health Network organizations. And we are going to kick off with MHP Salud.
Thank you, Alexis. And so I'm excited to share about MHP Salud. We are as Alexis mentioned, we're a diversified group of training and technical assistance partners. We work collaboratively, and what we bring to the table is a community health worker model. We are an organization of community health workers. We've been doing this for over 40 years, and so we're celebrating, actually 40 years. We're celebrating our 40th year this year, and we're very proud of that. And so we're a national nonprofit organization that implements the community health worker programs in underserved Latino communities. We also promote the CHW profession nationally as a culturally appropriate strategy to improve health through national training and technical assistance opportunities, as mentioned. Our roots date back to 1983, where the National Migrant Worker Council and an association of Catholic sisters had a vision to help migrant labor camps in Southeast Michigan. These experienced promotores from the Midwest were then invited to develop a program in South and West Texas, which we are now in the US-Mexico border region in the colonias. So this went also beyond migrant and seasonal agricultural workers, and we also started to look at other vulnerable populations. Next slide, please. So what we provide, here are a few of our resources that we do provide and trainings. So as a HRSA-funded national training and technical assistance partner, we have been funded for over 25 years to provide training and technical assistance to health centers with migrant funding. We specifically offer information about using CHWs as a culturally appropriate strategy to improve health in the HRSA identified priority areas, which include resource development, technical assistance, webinars, and learning collaboratives. Next slide. So here are a few, I'll go ahead and share in the chat. Here is a sample of our resources. This resource, for example, was on diabetes educational tools, also culturally appropriate, visually and linguistically accessible. And we supplied these resources in order to have diabetes control education management. There were 4 separate guides, both in English and Spanish, that we use, our community health workers use when working with someone with diabetes to help them manage their condition, as well as maintaining good eye, oral, and foot health. So these tools show that the common health issues are, what the common health issues are, and what are some ways to stay healthy. So this is a sample of the resources that we develop. And next slide. And so again, my name is Monica Garcia, and if you need to reach me, here's my contact info. I've shared our website in the chat, and I'll pass it on to Gladys.
Oh, before we do that, actually, Monica, since you have to hop off, I do want to provide the opportunity if anyone has any questions for Monica about MHP Salud, please go ahead. And I think I saw there was a hand raised, Jessica.
Excellent, thank you.
So if you have your hand raised, remember put your comment in the chat. So just feel free to put that on there, and as soon as we see that, we'll answer that.
And also, if there are any questions up to this point about anything that Margaret may have shared as well, please feel free to put that into the chat. But I do just want to provide that opportunity because we will have time at the end for discussion, but Monica does have to hop off. Patricia, is your question for about health centers or about the training and technical assistance that our organizations provide? In the meantime, Monica, do you want to respond to where in South Texas the offices are located?
Yes, so we are in South Texas, we are in the Westlaco, and we have most of our CHWs are in the Westlaco area. And then we have a few others near Laredo. So those are where they're situated. And then we have West Texas would be El Paso, where I'm located.
And then there's a question about, is the program only in Texas? If you wanted to share a little bit more about what you offer in Texas and other states.
Right. So we do offer, the majority of our CHWs are in Texas, but we do have other CHWs working out of Florida. And then also have offices in Michigan, which is initially where we started.
And then I see questions about Nebraska and other southern states. So I should clarify that all of our organizations provide training and technical assistance to health centers nationwide. And so in Kansas, in Nebraska, in Texas, across the country, we provide training and technical assistance. And so Monica, I don't want to speak for you, but if you want to share a little bit about the training and technical assistance you provide to health centers, specifically around CHWs.
Correct, yes. So as I mentioned before, so our CHW program is pretty extensive. What we do is we support health centers who want to implement a community health worker model or program within their health centers, or who are looking to strengthen their program. So some programs are getting started. So we have the training and technical assistance available for both CHW supervisors and CHWs. And we also supply resources. We have free online resources. So if you go to our website, you can find an array of wonderful resources that are free and readily available for anyone wishing to get more information on any of the chronic diseases that are experienced in our community, how to start a CHW program. Also, you'll find if you want additional training and technical assistance, if you're a health center, we are offering some what we call free one-on-one training and technical assistance. You can reach out to me. This will not happen until July, so we have some slots available for July. If you want to do a one-on-one training on starting a CHW program, what does that look like? Funding, all this information can be supplied through those trainings, along with free learning collaboratives for health centers and webinars for health centers. And we usually promote those on our website.
Thank you, Monica. And then I see some questions about older farm workers and who qualifies for services. I'm assuming health center services. So Margaret or Gladys, do either one of you want to respond to that question?
I can respond. Yes, aged and disabled migratory workers are eligible for services at all health centers. I think Margaret even responded to a question about status, if that was a factor. It's not. My aged and disabled migratory workers can still be categorized as ag workers in your UDS and are eligible for the same services that you would offer any other agricultural worker at your health center.
So we should mention that, we are talking about migrant health centers, and what we're talking about in terms of who qualifies as an agricultural worker. It's just, it's similar to, how migrant education has certain definitions of who qualifies as an agricultural worker. The health center program has certain definitions of who qualifies as an agricultural worker. And so when they provide their data to HRSA around the patients that they serve, there are certain definitions in order to qualify for them being considered an agricultural worker. And that includes family members. So any dependents, any children, and others who may live in the household could also be part of that agricultural worker definition. But health centers just generally serve anyone, regardless of their immigration status, regardless of their insurance status. If they lack insurance, there's what is called a sliding fee schedule, which essentially, and every health center has a slightly different schedule, but essentially the amount that the patient would pay would be dependent on their income and household size. And then there would be a schedule in terms of how much it'd have to pay for the services that they're receiving at the health center. So health centers see everyone. They see from babies to older individuals. And in fact, many health centers work with migrant and seasonal Head Start and work closely with the grantees in order to provide physicals to the children in migrant seasonal Head Start as well. So, and migrant seasonal Head Start, as you know, is under HHS, but that relationship in terms of building that partnership actually only happened recently in the last 20 years. So anyone can go to a health center is essentially the basics of that.
Alexis, I want to address just one question that was asked about whether we offered internships and scholarships. We do not at that time for students or anybody wanting to do an internship with us, but anything can change, right? So feel free to email me and I can forward this information over to other departments and see if there is an opportunity to collaborate in some form.
Thanks, Monica. Okay, and so we'll move on to the next organization, which is my organization. Farmworker Justice, we are a national organization based in Washington, D.C. We were founded in 1981. So we just celebrated our 40th anniversary a couple of years ago. And our mission is to empower farm workers and their families to improve their living and working conditions, immigration status, health, occupational safety, and access to justice. We are pretty multifaceted. So we engage in training and technical assistance, but then we also engage in litigation, in administrative and legislative advocacy, coalition building, and public education. And our unique niche within the Farmworker Health Network is twofold. One being information sharing about policies that impact farm worker families and their access to healthcare, as well as really thinking outside of the health center and promoting partnerships between health centers and other organizations that serve farm worker communities, including Migrant Seasonal Head Start, migrant education, community-based organizations, legal services organizations. And, our training and technical assistance is really around collaborations and health promotion. We have a number of projects on a variety of issues, including skin cancer patient navigation, healthcare access and health insurance, workplace harassment, heat stress, occupational safety and health, among others. Oh, and someone interned with us in 2002. So Bruce Goldstein was actually our former executive director. He was with Farmworker Justice for 30 plus years. He actually retired a year and a half ago. So, but certainly I will say hi. That's fantastic. We create a number of resources. Specifically, I want to highlight resources that we create for community members. So we have many training of trainers curricula, and these are on a variety of topics. And essentially, it's providing trainings to outreach staff or to promotores de salud, and then having them provide information to their community members. And then we also have a number of educational materials, videos, comic books, fotonovelas, recipe books, and others. All of our materials for farm workers are available in Spanish and English and Haitian Creole. We also have a number of resources in Indigenous languages, including Mixteco, Triqui, and Quiche. And the topics, just some of the topics for the resources include COVID-19, what are health centers and what do health centers provide, health insurance, specifically the Affordable Care Act, and access to ACA health insurance, skin cancer, heat stress, worker safety, and so on and so forth. So I certainly encourage you to go to our website, farmworkerjustice.org. We also have a YouTube channel that has a bunch of videos specifically for farm workers, but also just other videos about other topics that I encourage you to check out. And with that, if there are any questions, there was a question about mental health, but it looks like Jillian, you responded to that question. And so with that, we will turn it over. I'll turn it over to Liam at Health Outreach Partners.
Yeah, thanks, Alexis. Hi, everyone. And thank you again for getting this together and convening us. You know, the Farmworker Health Network is amazing for us to all gather because we do a lot of similar types of services. But as Alexis mentioned, we cover topics that, while they're complementary, they are all a little bit different. And so you may be hearing from each of us and say, oh, the services sound really similar, but depending on the different organization presenting, you know, I really encourage you to look at some of the different topics covered because, you know, we do trainings, we do webinars, we produce written resources, but they really cover a lot of different and diverse aspects of migrant health. So Health Outreach Partners, we have been around since 1970, so over 50 years, but in this model as a national organization over a little over 20 years. And we're based in Oakland, California, but we do work nationwide. And our kind of contribution in this world of the Farmworker Health Network is we are really focused on all things access to care and health equity. So we see that the best vehicle to provide care for those that are most vulnerable is through outreach. And so we really work hard to support health outreach programs through our trainings, our consultations, and our different resources that are available on our website. You know, I recognize some of the names of the attendees here. I saw Kate in the chat from South Carolina, where we just did a full day training on outreach program planning. So there's a lot available to you, and just like everyone else, feel free to reach out. Hey, Kate, feel free to reach out if anything catches your eye, or just, you know, take a look at our services afterwards. You can go to the next one. So, like I said, a lot of us provide similar services like consultations, trainings, workshops, learning collaborative webinars. So some of the different resources you might find on our website, a lot of toolkits and starter kits on different topics related to outreach and related to access to care. We also have a lot of innovative outreach practices and case studies. These, I think, are particularly of interest because while they are mostly from health centers, I think any organization that serves farm workers might be able to learn from some of these innovative outreach practices and some of the case studies that we've highlighted in innovative ways to serve this very specific and very unique population that has very high needs. So in general, some of the topics that we cover include DEI assessments, organizational self-care, a lot of program planning and evaluation, structural competency, the business value of outreach, making the financial case for outreach. We also do a lot around social determinants of health, and in particular, one that we focused on over the years is around transportation. So I also wanted to call that out since many of your organizations may provide transportation or have a big need with the people that you serve. And so we have a lot of different resources and reports around transportation, including a toolkit that can help you get started and also do quality improvement for your transportation services. Next slide. Some of our recent resources that we have released, one is a podcast series on the impact of COVID-19, especially on different vulnerable populations. We also have a DEI assessment tool that organizations can use to kind of evaluate their own practices around diversity, equity, and inclusion. And then a final resource that we produced with the National Center for Farmworker Health, who's also part of the Farmworker Health Network, on promising practices for farmworker outreach. And so that's kind of what I mentioned about highlighting practices that have been either innovative or especially impactful around serving farm workers. And we have a lot more on our website that you can find. And the next slide is just how you can contact me. And then there's our website, which is outreach-partners.org. That's where you can find all the resources that I mentioned, or you can just reach out to me directly if there's anything that you'd like to find out or learn more about. Thank you.
Thanks, Liam. Jillian.
Oh my gosh, are you guys tired yet? There's so much that we have to share with you. So we're very thankful to be here. So within the constellation of the Farmworker Health Network, the Migrant Clinicians Network is focused on clinical care and training and technical assistance for frontline clinicians. That also includes clinical training for community health workers and outreach workers as well. So really looking at what do those people in those roles in the health center or in community work need to know about the clinical nature of the work that they're working on. So our mission is to create practical solutions at the intersection of vulnerability, migration, and health. And if you want to go to the next slide. So we do a number of different things, as the rest of my colleagues do as well. We do develop resources for people to use with farm worker patients and other community members. We provide a lot of education as and technical assistance within our role as a member of the Farmworker Health Network. We do conduct research, as do some of my colleagues here, focused primarily on community-based research and looking at things that are really going to directly impact both clinicians and the patients that they serve. We have a bridge case management program, which I will go into in a little bit more detail, actually. We do a lot of work around worker health and safety, and also training clinicians around what it means to be seeing patients who are working in very vulnerable, well, high-risk occupations, essentially. We do, we have been increasing the work that we're doing around psychosocial support for providers. This started prior to COVID, but certainly during COVID was really a significant piece. So looking at what can we do to increase resiliency, encourage self-care, to look at ways that systems can be changed to better support clinicians and other people working in direct service. We do community-based evaluation work, advocacy, and then peer networking is a big piece of how we started. I know Monica, when she talked about the origins of MHP Salud, MCN has very similar origins in the 80s, and it was started by 3 clinicians who worked in very different areas, but all worked with agricultural workers and their families and felt very isolated in their profession. And so wanted to come together to find a way to be able to network with one another and share resources and that sort of thing. So that's really the origin story of MCN. Yeah, so the bridge case management program that I wanted to talk to you all about is called Health Network. And it is a program that we've had now for over 20 years. It's free to health centers or other places that are serving mobile patients. It's also free to the patients themselves. And it is because the healthcare that we provide in this country is very geographically static in general. You have your provider and your records stay where they are and so forth. And we're getting better about that, but it's still very static. So for patients who are moving, whether that's for agricultural work or for something else, we transfer their records, but really much more critically is that we help them find care in the place that they end up next. And we follow up with them, and we also follow up with the provider that enrolled them, as well as the providers that they end up seeing where they end up. So it's a really important program, and we've been highly successful in being able to get people into care. And I'd be happy to tell you more about it. And I think there might be this piece of it, actually Alexis from Farmworker Justice and I just did a presentation on worker health, occupational health. So this is a big component of what we do, and I just wanted to highlight it. There's a number of resources that Farmworker Justice has, as well as MCN, as well as some of my other colleagues here. But looking at, if we're talking about agricultural workers, as you all are familiar with, one of the major defining characteristics of the population is the work that they do. And that work happens to be very high risk for them, for their health, both in terms of exposure, as well as the potential for injury and then long-term musculoskeletal. So we do a lot of work trying to integrate worker health into primary care. And then the next one, I think, is just the contact information for me this is just for MCN in general. I'll put my email directly in, but our website is migrantclinician.org, and we have a ton of resources, as do all of my colleagues in this virtual space. I'll put my email in, but thank you all for having us, and happy to answer any questions as we go through.
We are getting questions just for anyone who wants to answer from the Farmworker Health Network. We have one about dental care, specifically in Mississippi. I don't think none of us work specifically in Mississippi, but some of us do work with health. We all work with health centers across the country. So I don't know if anyone wants to address that. And then there's also a question about mental health. Sarah shares that parents have identified access to healthcare, and especially mental health care, as a concern. And actually, I've seen that too when I spoke with parents from Migrant Seasonal Head Start. So she wanted to know if she could, if any of us could share information with parents about how to access mental health services. So I'll let anyone respond.
So I'll just go ahead and jump in and and just reiterate, that the Health Center program is a program with 1,400 organizations, 14,000 sites across the country. It is federally funded, but also receives funding through private donations, through insurance reimbursement, et cetera. They accept health centers as organizations, accept everyone regardless of ability to pay, regardless of immigration status, regardless of insurance status, et cetera. And they are required to provide primary care services, preventive care services, and enabling services. And the majority also provides some oral health services and mental health and substance abuse services, more and more. So the funding has continued to, the program writ large has received increased awards for for expanding access to care for those other services. But it's depending on the particular organization, whether or not they applied for and were awarded and built out those services. So some might have a dental operatory in 15 sites and have 3 chairs in each and 10 dentists on staff, and some might just have one or have a referral arrangement to another provider to provide those services. And so I'll just say one more thing about referral arrangements is that that many health centers provide on-site, and then many more still also have clear referral arrangements, written referral arrangements and agreements with providers in the community and other areas that will provide additional services like oral health, mental health, substance abuse, and other testing and other services to their patients. So it really is particular to the health center, but again, there are, and I didn't bring all the fabulous data with me in terms of like the number of health centers provide these different types of services, but when you reach out and you get on and you'll find a health center, you'll click on, then you'll go to the website and you might find one that has the full, you will most likely find one that has the full complement of those services in your area or nearby.
And Gladys, you shared something in the chat as well, if you want to share that.
Yes, NCFH developed a mental health hub with some patient education materials, and we actually have a handout that's titled "Preparing for Your Mental Health Visit" in English and Spanish. And so that would be a good informational tool just to talk about overall mental health and ways to prepare for an initial appointment if the family is being referred for those services. But yes, you can definitely reach out to your local health center to share information about any integrated behavioral health services that they provide. And then health centers also might have community referrals. So they might actually be able to refer you directly to any provider that they have already an established relationship for services.
And I'll just share before we move on that we are encouraging health centers to partner with Migrant Education, with Migrant Seasonal Head Start. So we certainly encourage you to reach out to health centers because we want to make sure that our farm worker families have a no wrong door approach and that anyone that they go to can connect them to the resources that they need. And with that, I think NAC is next in alphabetical order. So Margaret, do you want to talk about NAC?
Oh, I almost forgot about this part. So NAC is the National Association of Community Health Centers. So we are a membership association of health centers. However, we also receive a grant from the Health Resources and Services Administration, similar to the grant that the other member organizations of the FHN. And our grant is to provide training and technical assistance to all health centers versus just to health centers, migrant health centers. But we, in addition to the training and technical assistance work that we do, we also do a lot of work in the policy space and advocacy, as well as work funded by the CDC and work with clinicians across the health center program. Next slide. And I kept it pretty short because I wanted to focus on just what you all might need here. We have robust training and technical assistance for the health center workforce, as well as for health center governing boards. And we also administer the Health Center Resource Clearinghouse. And that site at healthcenterinfo.org hosts all of the training and technical assistance resources, not only from these organizations in the Farmworker Health Network, but from a number of other national training and technical assistance organizations. The majority of these resources are focused for training and technical assistance for health centers themselves, although there are some patient-focused materials on the site as well.
And then last, but certainly not least, Gladys, do you want to share about NCFH?
Yes, thank you, Alexis. So the National Center for Farmworker Health, or NCFH, has been providing services to the public for over 47 years. And one of the biggest things that really contributes to our mission, which is to improve the health of farm worker families, is the Ag Worker Access Campaign. And we collaborated with NAC actually in 2015 to launch the campaign. And all of the work that we offer really focuses on that. The campaign is aimed to be able to reach as many farm worker families as possible. And the goal ultimately is to have, over 2 million agricultural workers served by health centers across the country. And we still have quite a bit of work to do, although we have, according to the latest UDS data, reached over 1 million agricultural workers last year. So we're very thankful for that, but can definitely use your help and support in increasing access for ag worker families. Next slide. So I'm going to just do a quick overview of some of the resources and information that NCFH offers. We have a lot of population-specific information and research available. We've been very fortunate within the last year to receive additional funding to conduct research in particular with the impact of COVID. So we have a number of different resources available on our website and can even provide population-specific data if you're wanting to have more information about the number of agricultural workers in your region, or just want to get a sense of how many are served by the nearest health center that you're collaborating with. We can certainly provide that information as well. Along with population-specific data, we have a number of patient health education materials, resource hubs, and digital stories. We always try to create materials that are low literacy and culturally and linguistically appropriate for our populations. And we do a number of videos so that it's engaging and available for them to be able to easily access and view. One program that I particularly want to highlight is our Call for Help program, or Una Voz para la Salud. We developed this program a number of years ago and offer bilingual call for health specialists who can talk to actual agricultural workers live and in person and help connect them to their nearest health center. Call for Health also provides information about local COVID testing, offers interpretation support, and we have some financial assistance available as well for agricultural worker families. So I definitely encourage you to connect with us, visit our social media platforms for Call for Health, and contact us if you want actual outreach resources. We have little key tags that we can give to ag worker families so they can easily have contact with the Call for Health program, and we have brochures and flyers that we distribute as well as for you to be able to utilize in your outreach. Aside from that, we have a number of different COVID-19 resources. As you saw, some of my colleagues have also developed resources for COVID-19. I think all of us have made an extra effort since the pandemic to really develop materials in different languages so that agricultural worker families can have the latest information. So we at NCFH have different resources available in Spanish and also some indigenous languages, Haitian Creole, Mam, Mixteco, Purupecha, Triqui, Zapoteco. So we encourage you to please explore our website so that you can find those materials and download them so that you can connect and provide that information to your families. Next slide. A few other things that we offer in our services are workforce development through a number of training opportunities. We have learning collaboratives available every year. Right now in the spring, we actually have a couple happening, one in collaboration with the Farmworker Health Network that is about to wrap up, and the other our governance learning collaborative. We do a lot of governance training and strategic planning as well. So if you want to receive support for that, or want to connect with and receive more information on how to prepare board members, we are happy to provide that support. The other thing that I want to highlight, especially because some of my colleagues might have just come back from one of the stream forums, is our migrant agricultural stream forums. We have 3 main conferences that happen every year. We at NCFH host the Midwest, but the Western Forum just happened in California. And then the East Coast Migrant Stream Forum is also coming up in April. So we encourage you to connect with us if you want to attend any of those events. They are great opportunities for you to learn more about the agricultural worker population. Also a great way to connect with different health center staff and to just be able to know how to collaborate and create partnerships so that you can better reach agricultural workers that you serve. Next slide. And here's my contact information and all of our social media platforms where you can connect with NCFH. We also have 2 monthly newsletters that we encourage you to sign up for so you can receive the latest information about all of our training and technical assistance available. Thank you.
And I know that was a lot of information. Thank you to my my Farmworker Health Network partners for providing that information. I think we have a few minutes for questions. So if there are any questions that haven't been addressed, please put them in the chat. I see one asking about advocacy and community-based programs or partners in New Jersey. So for Farmworker Justice, we have worked with Legal Aid in New Jersey, as well as CATA, C-A-T-A, Comité Apoyo de Trabajadores Agrícolas, I think is what CATA stands for. And they do some work in New Jersey as well. So I encourage you to reach out to them, CATA. And then do any of my other colleagues want to, and of course, Migrant Seasonal Head Start as well, I'm sure has grantees. I'm not sure which grantee is in New Jersey, but you can go to the National Migrant and Seasonal Head Start Collaboration Office. Oh, perfect. And some of you may know Guadalupe Cuesta, who is the director of the National Migrant and Seasonal Head Start Collaboration Office. So we certainly encourage you to reach out to Migrant Seasonal Head Start as well. Do any of my other colleagues have other partners specifically in New Jersey?
I don't have a specific, but I would say that, and kind of pertinent to this whole kind of discussion around partnerships, is that in addition to connecting patients to like find a health center here, here's the number, call and get medical services, to the extent that you as are reaching out to a health center organization to connect with their outreach program or with their with folks in the administrative side of the health center, because they also are developing partnerships to best serve their community. As you know, as health centers are community-based care, that is part of making sure that happens, is ensuring those partnerships. So I think that would be something that specific organization, not that that I don't have off the top of my head, but that I think that you could really make some of those connections with if you find an organization in your very local area.
There is also a question about statewide organizations. So specifically for health centers, every state has what's called a primary care association. And so I encourage you to go to the Idaho Primary Care Association, but every state has a primary care association, and they are basically the representatives of the health centers in the state. And they also provide training and technical assistance to health centers. And we work closely with them as national training and technical assistance partners. So we certainly encourage you to contact them, but also feel free to contact any of us with any questions, and we certainly can connect you to people. So that's another option as well.
Don't know if the link that I just put in there, that last one, would be what you guys were referring to as the primary care associations.
Yeah,
Okay.
Margaret put a link to the Idaho Primary Care Organization Association. So every state has a primary care association. So we encourage you to check those out as well.
Yeah, and that has a map. You're right, Jessica. That the link that you provided, if you scroll down, has a map where you can click on the whatever state or territory.
Mm-hmm.
Well, you guys are a wealth of information that we're all just taking it in, and we would encourage migrant ed programs. We will send out this presentation that they have. I'll go through the chat box and leave this up for a little bit so that I can get all the links. And if you registered for today and you're here today, I'll send that to your email, and we will also post it on our website. So I think this is a really good example of, there are lots of organizations out there working with the same populations that we're trying to work with. And it really behooves us to be aware of them and then to be able to make a plan moving forward. So hopefully our families are able to really benefit from the resources that are out there. And, you know, all of us together, definitely, I mean, across the country, we can make sure that this information is out there. Do you want to ask a favor for everyone? Anything we do with IDRC, we always have our lovely evaluation. And I would ask you to take your time and fill that out, and also put in the topics that you would find helpful for future trainings. If you guys want more health trainings, if you give us specifics of what you'd be interested in, we'll definitely see if that's a way that we can move forward. So again, want to thank all of our presenters, and for the time that you guys had kind of collaborating and putting this together. You did it perfect. We only had an hour, and I'm amazed at the amount of information that you were able to share with all of us. So thank you very much for your time and willingness to share with us.
Thank you, everyone. Have a good rest of your day.